Welcome back to Showcase Pittsburgh on KDKA-TV. I'm John Klein. Today, 8 businesses. Chris Horney from Rebath, Joe Flynn from Flynn Tires, Dr. Nathan Lockery from Aspen Dental, Cookie Harris from New Image Hair Clinic, but right now, Ian Bulow from Revive Upper Cervical Chiropractic. Welcome to Showcase Pittsburgh, Doctor.
Thanks for having me.
Give us a little background on you and your practice first, and then we wanted to get into some specifics.
Sure. We've been in the greater Pittsburgh area for the last 5 years. Actually, October marks 5 years for us, and it's been really exciting. We are one of about maybe 5 or 6 offices that specialize in what we do in all of Western Pennsylvania. So the whole reason we came back home here was because there's a drastic shortage of upper cervical specialists. And what I mean by upper cervical is it's the top of the neck. Cervical means your neck area, you know, and so upper cervical specialists are chiropractors. But it's different. We're not going in and just kind of moving for range of motion's sake. What we're doing is we're looking at the point where your head and neck actually come together, because that's the point where your spinal cord originates.
Okay.
So when people have neck instability, the implications are far more drastic than just a sore muscle or a sore back.
Is this something that if you get injured today, you're going to have issues, or you could have gotten injured years ago and you have residual issues your entire life?
Yeah, and that's honestly, we're finding more and more of that, is that as adults come in today in their 40s and 50s, they have a history of a whiplash injury, you know, when they were learning how to drive, or maybe when they were playing football in high school or college, or maybe they just fell down a flight of stairs or slipped on the ice, and at the time, nothing appeared broken. You know, someone can get in a car accident, for example, 10-mile-an-hour car accident, just a fender bender, you know, it's not thousands of dollars of damage, just a basic thing. But what we're seeing now with upright MRI studies is that there is lasting ligament damage to the neck that leads to chronic issues later on in life. And so people may have aches and pains from a current injury, but very often what we find is that later on it leads to, you know, just chronic headaches, arthritis, digestive disorders, different neurodegenerative disorders even, some serious things like multiple sclerosis and seizures and pretty heavy things.
Right now there's somebody watching going, I told you I've had issues with this for years because when I played high school football, and I'm guessing that now we're being more aware of the injuries when kids play sports, that it really affects adults.
Absolutely. If you take Sidney Crosby, for example. He got in this huge concussion injury, massive damage to his neck, was getting nowhere for the most part, and he went down to a chiropractic clinic down in Atlanta, and that's where he first started to see results with him. It's the same thing that we see in our office, is that people, it doesn't end with the neck. It starts with the neck. And then downstream from that, just like if someone has a heart problem, that leads to other issues in their organs and everything. When someone has a neck issue, those nerves help the brain communicate with all parts of the body.
Is that something where if you're injured, you would have it your entire life, or can these things be corrected or fixed or repaired?
That's a great question. And obviously, like most things, the sooner the better. And so one of the things that we wanted to offer to people in this month of October was the opportunity to have this looked at. We take it very seriously, honestly, really seriously. Just like you would check the heart of a child that's a newborn baby, we want to check the spines of people, especially if they've had an injury. So if someone's watching and they have they had a slip or a fall, or they had a car accident, or even if they were told that nothing was wrong, that may not be the case. And so what we'd like to offer in celebrating 5 years is that if someone's sitting at home and they've had x-rays taken, they've had MRIs taken, or maybe they haven't, and they just know something's not quite right, that it's not normal to keep taking medications, it's not normal to always wake up with a pain or a symptom of some kind. We want to provide them an opportunity to come in the office. So as long as they get in the month of October, we're offering a free review. So we'll sit down with them, we'll do a consultation with them, see what their health history is, what injuries they've been through, and if they have any MRIs or any x-rays, bring them along with. I'd be happy to sit down with them, review them side by side. If they don't have any, we can have them sign a form and we can get that on their behalf. But I think it's really important to have that evaluated. If they've never had this evaluated, in my opinion, healing starts at the top. And that's really where we got to start that journey.
What's your advice for, there are a lot of parents with children who are playing sports, and there are a lot of sports-related injuries where it seems like front and center in the news every other day there is a professional former athlete who's got some side effects from something that happened years ago.
Correct.
What advice do you have for parents who have children who are playing organized, well, even unorganized sports?
Sure, it's a great question. I always tell my patients, you're here to do more in life, not to do less. So I try not to restrict people and put them into this little bubble, but let's take it seriously. If someone has an injury, you need to have them checked out. It's not, and you got to listen to the kids. The kids will tell you, this hurts. And a lot of times we're just told, well, just rest, you'll be okay. You just pass it off. But that's not the case. The case is there's something wrong and that should be looked at. And like most medical and health issues, the sooner the intervention, the better the outcome. So if a child's fallen down a flight of stairs, if a child's had a whiplash injury, if they had their bell rung, they really need to be seen by a professional.
Advil is not the answer.
not in the long term. No, not in the long term.
If you'd like some more information, call Dr. Bulow. If you need some info about the Revive Upper Cervical Chiropractic Center, call them at 724-772-7060 or log on to revivepittsburgh.com. If you'd like to be on our show, call us 412-575-2400 or email at showcase@kdka.com. Coming up next, Chris Horney from Rebath. That's on the way when Showcase Pittsburgh continues.